Good day, ma'am. I am Rachel May M. Morales, BSN 2 Section A. For today's return demonstration, I'm going to perform perineal care. So before, during, and after the procedure, we're going to assess for any excessive discharge and odor on the perineal area and presence of irritation, inflammation, and swelling. So in the hospital setting, we're going to place paper bag on a paper line table, while in the hospital setting, we're going to place paper lining under the tray. So now we're going to identify and explain procedure to the patient. Good morning, ma'am. I'm Rachel May M. Morales, ma'am, and I'll be your student nurse for today. May I check your wristband, ma'am? Can you please state your full name, ma'am, and your date of birth?
Kathleen Joy and Lobo, February 2, 1980.
Okay, ma'am, thank you. So I am here, ma'am, to perform perineal care. So I'm going to clean your vulva and your perineal area, ma'am. It is to reduce a risk of infection and to enhance and promote healing of your perineal area, ma'am, after your vaginal delivery. So is that okay with you, ma'am?
Yeah.
Okay, ma'am, thank you. So now we're going to wash our hands or perform hand hygiene to prevent transfer of microorganisms. After that, we're going to assemble needed equipment and bring to bedside. So we have here our equipments: towel, washcloth, perineal pads, clean gloves, bath blanket, waterproof pad as an alternative to Calipod, kidney basin, cottables or soap with soap solution, working forceps, pitcher with water, our sterile gloves, our sterile set to enclose the dry cotton balls or soap with betadine solution, and then the sterile forceps. Then we have down here our bedpan that are covered and with paper lining. So now we're going to screen the unit and put on pair of clean gloves. So now we're going to place client in a dorsal recumbent position and assist client to flex knees and spread legs. And after that, we're going to place the Calipod or the waterproof pod under the buttocks. So can you flex your knees, ma'am? On. The other one, please. Okay, very good. Pwede mo i-isa imong buttocks. Can you raise your buttocks? And then we're going to remove used perineal pads or dressing, and then we're going to dispose it properly. Then we're going to drape patient properly. Then we're going to let the patient void. It is to prevent or to avoid interruption during the procedure. So we're going to use a bedpan. So can you raise your buttocks, Mom? Okay, very good. So after that, we're going to pour water over the vulva and making sure that there is no spillage. So using the forceps, we're going to pick cotton ball, moisten with soap solution. And then we're going to cleanse in the following order using 1 cotton ball with its soap. So first in the urinary meatus. Perineum to anus. And the farther minora. The nearer labia minora. Farther labia majora. And then the nearer labia majora. And after that, we're back on the urinary meatus from perineum to anus. Okay. Then we're going to repeat procedure if necessary or when necessary. Let's do it again. Using the same procedure. Urinary meatus. Minora. Majora. Then back to urinary meatus. Then we're going to flush again with water on the vulva and rinse soap thoroughly. So now we're going to change our gloves to sterile gloves. So now we're going to dry perineal area thoroughly using dry cotton balls to remove soap. Then we're going to discard properly. So ma'am, ako nang pamalhon ang imong perineal area. So after drying, we're going to use picking forceps again to pick cotton ball moistened with betadine solution. Then we're going to cleanse in the following order using 1 cotton ball with a stroke. So ako na pong pahiran ma'am og betadine solution ang imong perineum ma'am ha. Okay, so from the urinary meatus, discard. Further labia minora, nearer labia minora, farther labia majora, nearer labia majora, back to urinary meatus. Okay, so after that, we're going to remove now the bedpan. Then we're going to let client lie on her side. Then we're going to check the anal region, then wipe dry. So, ako lang po ang bedpan, ma'am. Can you raise your buttocks? Okay. Thank you. So, straight, ma'am. So, pwede ka mo atubang dito, ma'am. Can you face it there? Okay, thank you. So, pwede na tayo mabalik, ma'am. Okay, that. Then we're going to assist patient in putting new perineal pads or dressing. Okay. And then we're going to put patient back on supine or comfortable position. So, ako lang din po on, ma'am. Can you raise your buttocks, ma'am? Okay, thank you. Done. We are done with our procedure, ma'am. So thank you very much, ma'am, for your cooperation.
Thank you.
Oh, you're welcome, ma'am. So how do you feel right now, ma'am, after our procedure?
Feels great. Thank you.
Okay, so thank you again, ma'am. So now we're going to do aftercare of equipment and return equipment to proper place. So after that, we will now remove our gloves and perform hand hygiene. And lastly, do charting. Okay, so Lucia rubra is present, dark red in color, and no foul smell.